The top 3 myths in chronic pain that you need to be aware of when talking and choosing your doctor. My name is Dr. Michael Vancheri. I am a chronic pain specialist here in New York City. I specialize in individuals that have had pain for more than 6 months and have seen 2 or more doctors. Let's get into it. Number 1, your SI joint pain is being caused by your SI joint. Now, if you're unfamiliar, SI means sacroiliac. It's a common thing for people to complain about when they're going to see their doctor for lower back pain. You'll hear from those doctors is, oh, we need to manipulate your SI joint, we need to mobilize your SI joint, and your SI joint pain will go away. That is false. 95% of the time, your SI joint pain is actually referred pain from the L5-S1 disc. It's called sclerotogenous pain referral pattern. You can look it up. If you can decompress that disc, if you can heal that disc, that pain will start to go away. Now, that doesn't mean that you shouldn't treat the SI joint. That should be reserved for the end of a care plan. If you get that sclerotogenous pain referral pattern for a long time, it will shift the biomechanics of that joint and you will eventually get some arthritis there. Let's move into number 2. The pain that you feel in the front of your hip when you squat is caused by your hip flexor. 99 times out of 100, if you are squatting and you feel pain in the anterior section of the hip, you have a lack of hip flexion. So it is not your psoas, it's not your iliacus, it's not your rectus femoris. It is most likely your posterior inferior joint capsule, so the bulb ligaments and tendons that surround that femoral acetabular joint, in conjunction with your adductor magnus, which is this hybrid groin hamstring muscle that gets tight over time, the more sitting, the more squatting that you do. Number 3, pain in the back of your knee while bending is a hamstring issue. That is not true. Pain in the back of your knee when you are bending that knee most frequently is a meniscus problem. The meniscus is a piece of cartilage that helps increase the surface area of your knee joint, can act as sort of a cushioner, but not really. It's really meant to increase the stability. The pain referral pattern for a meniscus tear or a meniscus degeneration is pain in the back of the knee. So if you're going to your doctor for any of these problems, understand, appreciate, and know ahead of the time what your diagnosis is likely going to be so that you can choose a provider that is going to treat the right structures to get you out of pain. Hopefully this helps for you. Hopefully this is a nice short video. If you enjoyed this, like, subscribe for more of this content. Take this knowledge, make better informed decisions when you go to the doctor, and remember, pain-free people change the world.